Good morning, everybody. Dr. John Willardsen here with my compadre, Guillermo Hea, and today we've got a great show or live stream put together, and we're going to talk about various subjects that we feel are necessary for those patients seeking after this sort of treatment. Again, it's an important treatment because once done, it's got to be done correctly, and it's got to be done with the most ethical and the standardized care possible. Even though we are kind of in the wild, wild west, there's nobody controlling somebody who loses their teeth and has it reconstructed. And there's no organized political body like the American Dental Association, the American Medical Association, that has the ultimate say in what happens and what occurs and what implant is used and what technique is used. And so, unfortunately, as the patient, you are left to the trust of the doctor who is providing the procedure. And granted, this procedure, of all of the medical procedures, of course, aside from like a major brain surgery or spinal surgery, and even those financially can be about the same cost as having all of your teeth removed and replaced. And so we'd like to take a look at some different scenarios. But first of all, I'd like to check in with Memo and see how his week's been going and anything you've learned this week or any you're so good at giving us insight and inspiration.
Well, first of all, it was good. Good weekend. It's been a little raining and cold here.
Yeah.
Well, this weekend, a lot of it we spent with you and your family because
which was great.
It was great.
Yeah.
And you'll probably get more into it, right? One of your kids got back from his mission, so we had one of my friends was in town. One of our friends, you know, staying with me, and it was fun having him. But it was raining a lot. I feel like in the whole country it's been here in the U.S. it's been cold, raining, snowing quite a bit, right? Everyone who's watching the playoffs can see that. Mm-hmm. But no, yeah. Other than that, it's been a good week. Trying to stay strong to the goals, right, and the systems that we implement. I have a friend who's also in town visiting, and I wanted to talk about this. It's kind of something interesting that we always talk about. I don't know if right now is the right time or we can wait till later.
Hey, we are on the fly, so whatever works.
Okay, perfect. Well, let me get into it because I thought it was very interesting. I've known him for like 10 years. He's an amazing salesman. He's done sales for solar companies. And like especially in Utah, the door-to-door sales is pretty big, that industry. So and that's like the hardest form of sales, I would say, is because it's not like you're cold calling, you're not in a mall standing there, you're not in a car dealership, like you're literally going to people's properties.
Right. When
you see the no soliciting sign and then you're trying to sell them. So it's required tonality, like body language. So you kind of have to be the best of the best. So he's doing solar here, but he was telling me that he applied for well, first of all, he asked me what I do. And I was like, well, I work for this implant company. And he's like, oh, that's funny because I just applied for a different implant company. And he told me the name of it. And it's one of those companies that we've talked about before here, is the big implant centers. I don't know if I'm allowed to say the name. I wouldn't.
It's a corporate all-on-4 center. They are the ones who tout that you walk in and have the procedure done and you leave the next day or the same day with the final permanent set of teeth. And so they're the ones, everybody has to create a niche, even though in reality when you talk about all-on-4 procedures, they are all exactly the same. Not one procedure is better than another. And so I think that their niche is that they offer doing the implants and making the final set of teeth all in the same day, which in reality is not that difficult because all you do is avoid the PMMA procedure, the plastic version, which we like to use so the patient can wear it, get a feel for the aesthetics, the function, the bite, and everything. But they're going straight to this. It's like Vunia or something like that. The name of the company is like Vunia. And they go straight to the final prosthesis.
Yeah, and that's actually interesting that you say that. It's like when you go to a car dealership, the salesman letting you drive the car to see if you like it. The PMMA, let's say, right?
Yeah.
Because you get to drive it, and if you like it, great. Like you get to keep it, right, for a month or something like that, which is a step that they skip. They just go straight into giving you whatever they think fits. But anyways,
What would you say that the risks of that might be? So you've got a patient, you've just probably most likely extracted all of their teeth. You've put in 4 implants, and then you make them the final set of teeth. In your layman's mind, what kind of resonates with you as to, wow, that's pretty cool because I get the permanence same day. I don't have to deal with going back and forth to the dentist. I can have it done, like one and done kind of situation. What are some things that you think of when you hear that, especially now being around it? You've seen the complications, not complications, but you've seen the length of time that it takes to do a case properly, to allow implants to integrate properly, and to have a result that patients are happy with.
Well, like you said, now that I know what I know, being around all this and around the industry, yeah, I mean, definitely makes me question. But it makes sense why they do it, right? Why they're doing it, how they're doing it. But also, like for me, like we've mentioned before, is we just kind of trust the doctor and we're like, whatever. And if we don't know that it's required a certain amount of force to bite, and all these things,
Or healing.
or healing time, then I would never ask, right? Same with, I don't know, we like to use this as an example as well, the mechanic, right? And that's why I have sisters, like my mom, they always hate going to go to the mechanic because as a girl, for the most part, you don't know about cars. So you feel that like it's easier for the mechanic to screw you over because you can't question. And
Right.
Let's say as a guy, we know cars and he's like, well, it's missing this or that. And you're like, what are you talking about? And then you get to question it and fight it back. But we don't know medical terms like a regular user. So we can't really question. But now that I know this, I'm like, man, I'm going to question my chiropractor. I'm going to question everyone. Like, why do you do that? Or give me my options.
Yeah.
I want to know the options for the long run, for the short run, and the cost difference. And if this costs more, but I won't have to deal with it, then I'd rather go with this, right? Because I don't want to come back, especially when it's like the dentist, like not working here, but everyone hates going to the dentist, getting it cleaning. It's just painful. And so the least amount of time that I can spend with the dentist, the better. And I think that's why for patients, the teeth in 24 hours, it's so appealing. It's because they're like, well, I want to get in there and be gone.
Yeah.
Because we see it here too. Like you do the PMMA and you send the patients home with the PMMA, which is a temporary. And so they have to come back to make sure that fit right. The bite is everything. And then you have to adjust that, send it to the lab, make sure that it's good. And then they come back and then that could be a 2 or 3 step process, right?
Right.
But we're doing it, and the patient understands because we're doing it, so it's done right.
Yeah, it's funny because I saw a meme online, and it was maybe it was a TikTok, I'm not sure, but so the daughter, the air on her tires was low, and she was actually messing with her dad. And so she pulls up and, gives her hugs to her dad and said, "Hey, Dad, guess what? I put premium air in my tires." And he was like, "What are you talking about, premium air?" He's like, "Yeah, no, the tires were low and I filled it up and I used premium. I wanted the best air possible for my tires." He's like, "Are you kidding me?" And so, long story short, she said, "Yeah, I gave him $20, and he put premium air in my tires." And so, and the dad is just losing his mind. He's like, "What are you doing? What did I raise?" He's like, "You stupid idiot. There's no such thing as premium air. Air is air." And so it was kind of I think it was all staged. But the point being is, you don't want to buy snake oil. You don't want to buy something that is too good to be true. But in the end, does not serve the purpose for what you want it to serve. For example, I won't even get into the all-on-4, but teeth in one day, and then I would love to see the prosthesis of this teeth in one day and the quality of the materials, because I know how long it takes for us to turn around a high quality prosthesis in zirconia, one that I can feel proud about putting in the patient's mouth. And for me to try to turn and burn those and deliver them in 24 hours that's a tall order. They must be really, really good, because I know in the hands of many other master technicians, in the hands of excellent surgeons, teeth in one day would be a very challenging thing to do.
Yeah, I agree with you. Well, then, going back to the story, right? So he applied for the job because a few of his...
So he's applying for... What's the job? Like, what is it that he's applying for?
It's called, because I found the job actually on Indeed. It's a sales rep job, and it's called Implant Sales Rep. And it says the pay is from $125,000 all the way up to $300,000. And I saw all the other jobs that they're offering, right? Surgical assistant, even like business manager. The only other job that gets paid more with this company is an oral surgeon. So it's like, as an implant sales rep, you're making just as much as the actual surgeon, right? And it's because, from what he was telling me, he's like, oh yeah, like my friends tell me it's so easy. You just have to be good at sales over the phone. And they're selling people these high ticket cases with like high interest, just getting them to sign, and then they get their commission. And reading the ad is just basically all it is. Like, to these companies, well, first of all, not only to these companies, but to these sales rep, like the people who are calling the patients, right, and saying, hey, like, you fill out an application or come in for a consultation. First of all, they're just salesmen,
Yeah.
6 months ago, 3 months ago, a year ago, they could have been selling for T-Mobile or anywhere else. Like, that's the nature of a salesman, is there's no loyalty in the industry. And I only say this because I did sales for a long time.
That, right?
And I didn't want to be part of it, because the more you spend time with certain people, the more you become like them. Mm-hmm. And just the nature of sales, it's a lot of people who are lying, a lot of dishonesty. Like, you pretend like you care about the customer, but in reality, it's all about numbers, right? I'm doing this to help you out. But like, sometimes you'll do whatever you can to get the sell. Like, you'll go above and beyond, but not only for your gain, like you're making money, but like in the sales world, like you want to hit those numbers, right? And it's basically what it says here in this ad is like, you have to reach a certain amount of numbers. And the ad says that 66% of their implant sales reps will make more than $200,000 this year. Like, that to me is crazy. Like, again, and that's, again, why we do this live stream, is to create that awareness for patients, to educate them. So when the sales rep call, you have some ammo, right, to be like, all right, well, let me look at my options, because what they're trying to do is just get you to sign, and then that's it. Like, you're stuck, and you'll be happy with your teeth for however long they last. Yeah. But anyone in their right mind, if they had the option to go with something that's going to last longer or something that's not, because you don't want to come back, or you don't want to go back to the dentist. Anyone in the right mind is going to choose doing it the right way. That's going to last longer. And in reality, from what he was telling me, the price is not even that much different.
Yeah, it's not.
It's basically the same.
It can't be, because our overhead's the same regardless, whether it's here in Newport Beach or whether it's in, I think they have a couple of offices, but Downey or somewhere like that. Yeah. Cost is the same. The amount of work is technically the same. Overhead is the same. They may have streamlined a bit of a process, but they're not saving hundreds of dollars,
Yeah. In their title, it's just, anyone can go in and read the description, but it's the title for the ad is Implant Sales Rep, but it says right here clearly that their title in the company that they're going to tell the patients is going to be smile consultant or smile expert. And to me, I'm like, what does my friend know about all on 4, all on 6? He was just in the solar industry. Like, how is he a smile expert compared to you? Or even like,
or even you.
I'm not even a doctor or anything.
Yeah, but you have a lot of knowledge.
Exactly.
You've been in this
like,
a long time.
I can go at it with them and just kind of just say, like, you don't really know. How would you be a smile expert? So I just think it's interesting how we've talked about this.
White, not white. That's
Exactly.
your smile expert.
Exactly. And I mean, we've talked about this so many
Straight,
times in
not
the show.
straight.
It's to these big implant centers, and it's a big implant centers because it's basically like a franchise, right? A McDonald's. You'll see the name in
100%.
every city.
Clear Choice, Nuvia, I don't know. There's a whole bunch of them.
You look it up on Google, you look it up anywhere, and it's the first ads to pop up because they have the money.
They have the money, the budget to spend, yeah.
To be up there. But it really, if you go back to the higher ups, it's just people with money who want to get a good return. And they found that in the dental world, which is one of the most...
The dental implant world specifically.
Exactly. Dental implant is like the industry that makes the most money in the dental world. And the dental world is one of the most securest industries, like recession proof, and for the most part, right? That's why investors look into it. So to them, patients are nothing but a number. And so that's why they've created these systems where they understand that everything, just in business, basically it sells, right? Because like you can be the best writer, but if your book doesn't sell, then no one's going to know about you. That's why in the top right corner of any book says top bestseller, not top best writer, right?
Yeah.
Or like if you're the really good doctor, but it's hard for you to sell your services, like patients aren't going to know about you. So they've understood this, and they said, we're going to pay our sales rep almost as much as we're going to pay a surgeon, because they're the ones that are going to generate and drive the revenue into our practices. Because they understand that also to salesmen, they just want to be incentivized. They're just a number. And potential patients, customers have to be aware of those things. Right?
Yeah,
they have to
sure.
really do their research and understand the options that they have out there.
Yeah, because you could get sold, right? I mean, like when you were selling solar, you can sell a solar, and I'm sure the services you were providing were good. I mean, you can make the sale, which is great, and everybody gets paid, but after that, it's delivering the goods, right?
Mm-hmm.
Delivering, in my case, a prosthesis, a design, number of implants, materials used, that the patient can then protect the investment that they've made so that it'll last them the rest of their life. And so, I don't sell. I don't, I present, I educate, I talk about the pros and the cons, but how many patients that I've seen here at Trust Implants that have shown up for a consultation, we've had our discussion, I've actually taken a $750 CAT scan on them and about $200 worth of x-rays, plus my time, which is a good $1,000 an hour. So, but I don't charge one thing for that procedure because when a patient does sign up, I value that patient and we give them the very, very best possible outcome. And so we're not about sales, you'll never see me come across as trying to sell you something or upgrading you into something or doing something that would be, kind of like in the sales world. For one, I don't know how to do it. And so it's I should probably be better at it. But to me, I know and I trust and I believe in the procedure enough, and I've done enough cases to where I really don't have to sell. It pretty much sells itself. And as a result, I'm able to be successful in that way. And for me, that's what I want.
Yeah, that's right. And then also, there's times where they deal with you, they talk about finances with you because sometimes you work with patients, right? Like with the price and stuff like that. And so even after they sign up and they go through treatment, you're still the person who signed them up, who was there from
100%.
Beginning to end. How many times have we all experienced getting sold on something and then later, well, right after that, the
Like
salesman
a bait
is
and switch.
the salesman is nowhere to be found. The same person that promised you the moon and the stars, completely gone, right? They pass you over to someone else, your account manager, in this case, the oral surgeon, and then after that, like the patient coordinator who's going to deal with you, and then after that, the prosthodontist, and then it's just you're passed around from one person to the next, and then you're like, well, what about the person?
What about that guy that I talked to that sold me on it? Yeah.
That told me I was going to get this, and that. And that's, I think, again, that's the difference between what we're doing here, not only at Trust Implants, but with Trust Implant Partners, is we want to keep that within the private practice. So then,
100%.
Because how many times, again, you go to the mechanic and I want to talk to the main person because I want to know what's going on, right? And that's you here. But if you have 5 other people ahead of that, like, it's just plain telephone, right?
Yeah.
Like, you're never going to be understood. You're never going to understand what they're trying to do. And it's just going to be more of a headache.
It's true. And what you just said about the mechanic, it reminded me, again, going back to my truck, a brand new, basically 2022 Ford Raptor. I mean, at the time, you could buy no better truck. And it has now been in the shop since November, I think it was the 9th. And nobody can figure out what's wrong with it. It's gone to every department within the service department. Apparently, I don't know how honest. And again, you don't really know how honest they're being. And it's at Theodore Robbins Ford in Costa Mesa. Apparently now there's a Ford specialist technician who's coming in from Detroit. I mean, at the end of the day, how hard can it be? I mean, they work on Ford trucks, they deal with Ford trucks, but here I am now almost 3 months later, no truck, but I'm the one that has to suffer. Not that I'm suffering, but I equate that to a patient who signs up for treatment, gets sold, the genie's lamp that it's going to solve their life, gives the money, but then really is when the problems start. The prosthetics fail, implants fail. It's this snowball effect to where they are really having to pay for having had paid for something that could not withstand the loads and the factors that are important that our mouths provide on a daily basis.
But also going along with that, because I just want to clarify things, doctor, because this isn't the case for everyone.
No,
right? There's plenty of cases.
It's just the ones we see, because we see the failed cases.
Yeah,
from
exactly.
Other doctors.
So there's plenty of cases that do succeed, but I go back to if 99% chance of this succeeding compared to 50 or 60%, like anyone in the right mind is going to choose this one, right? If it's the same price, and then just probably like better service, obviously, and like just the whole every step of the way just better, then obviously I'll go for this one. But yeah, we don't want people to think that like they all suck. They don't know what they're doing. It's just
I'm not saying sorry if I had came across that way.
Same for me, because I feel like I did kind of came across like that.
No, because there are plenty of doctors out there that are doing the right thing, that are having success, even with the all-on-4 procedure. There's plenty of all-on-4 procedures walking around out there that are happy, that are successful. But if you're new to the game and or considering the process, you want to know your options. It's why we've developed this channel. You want to know what options you have, so you can make an educated guess as to what's the best thing for you. All right, so these are mini implants done on a fixed bridge. I could show thousands and thousands of x-rays of situations where patients spent a lot of money and ultimately end up with major complications on their hands. Typical all-on-4 procedure, implants angled, avoid the sinus, not considering even at all the lower arch. So the forces that these 4 implants are going to take from these lower teeth are tremendous. And again, I only show this not to condone the doctor, but we have to look at the case comprehensively. We got to consider, okay, what are we doing on the lower? What is the ideal treatment for the upper? And that's when you end up with a successful case, regardless of who does it. And so it's important that, and of course it can be more expensive. You know, if we're talking about redoing the upper and the lower, the cost can go up significantly. But your investment goes up tremendously because you don't end up with so many complications. I showed this x-ray last week. Patient had come in for a consultation a few years back. The only reason I'm showing it again, we're losing 1, 2, 3, possibly 4 implants. He spent a lot of money. He came in to have a consultation. We discussed. He sounded like he was going to move forward. My fee was too high, which I get. So he had mentioned to the staff that he's going to Mexico. There is absolutely nothing wrong with going to Mexico. I know physicians or doctors down there that can do an excellent job. Now, the question is he's already spent a lot of money to this point. And so I would question, not him because he's already made up his mind, I would question a patient to, when you have to do it again, really do your due diligence and really look into what is best for you, because certainly you don't want to do this all over again and then have similar types of situations or complications. It's too expensive. It takes too much time to cross the border. There's, like I said last week on our live stream, there are so many unknowns on this case and no plan whatsoever. But, everybody has their free agency and they can do as they will. But it will be the type of case, because I just don't know what's going to change. You're going to move implants, you're going to remove implants. I really can't imagine anything is going to change in this case. So, all right, so let's see here. Again, typical all on 4. We talked about this on the last live stream. Here's a patient who needs all of his teeth removed and did that, was able to place 8 implants upper, 6 on the lower, and then restored his mouth to ideal. So this is the standard. If I can get a hold of the patient at this stage, I'm going to have a lot more success than if I were to get a hold of them at this stage and have to really rethink and regroup. And so in this case, it would be expensive, no matter how you slice it. I have to remove implants, redesign the case, put the implants in the position that they need to go into, and not do this workaround to where I'm, excuse me, having to, just kind of fudge things so that it turns out okay. Here, we do not want it to turn out just okay. We want it to be perfect.
Doctor,
yeah.
In a situation like that, because I actually don't know, let's say a patient had failed implants and they go to one of these all-on-4 implant centers.
Yeah.
Do they even treat them? Or what do they do? What
can
they do?
I don't know, actually, because I've never been. But I do know that they get multiple doctors involved, which can, and that's a good question because it breaks up the continuity of care. So when I do a case, I design the case, I execute on the case, I put the implants in, and then I design the bridge or the prosthesis. So I have full control over that. Now imagine if I design the case, hand it over to a surgeon, a different surgeon, to place the implants, and then I hand it over to a prosthodontist to do the restorative. The entire continuity of that case has now been lost. Not that it can't be done, but it is something to consider,
Yeah.
And so you're right. That's definitely something to consider.
Well, that's probably why we see a lot of those here.
Yeah.
Maybe they even get turned down and they say, you're not a, because I feel like that would be too much. I mean, it's too much work for you.
Yeah,
It's a lot of work. And that's why for cases like that, you charge, it's not just your regular all-on-6 where it's just like easy place, and then do the prosthesis. Again, it's like tearing down the house, cleaning up.
And rebuilding.
Like getting the blueprints so it actually gets done right, and then rebuilding.
Yeah.
So it's almost double the work. So.
Yeah, it takes, you have to be laser arrow focused in doing these cases and know exactly where you're headed. And that is really the key to success. So, okay, let's see here. So anyways, moving right along, that was a pre-op photo. Here's a post-op, and you can see all of her teeth are replaced now in the back and the front because she was only chewing on her front teeth, wearing, breaking down. There's decay. And so she was adamant about having her mouth fixed correctly, and she's a wonderful patient. She did what was necessary, and we ended up with a very successful case for her. Same thing here. I don't know why it keeps hopping around, but same thing here. And I could show cases all day long, and I've shown a lot of these cases. So, but anyways, well, this week, again, it's been a great week, and we appreciate our followers and the people that actually watch this show, the 6 people that watch the show. I know that it will start to grow, and it'll start to grow legs. I would like to share, so this week, as I had mentioned last week, and if there's any comments, please ask in the comments and hit that like and subscribe button. I would like to share a little bit about, maybe a little kind of boost us up for the week. This is a scripture in the book of Nephi. And in the book of Nephi is a prophet from the year 600 BC. And this is actually the first chapter of the first verse in the book of Nephi. And he says, I, Nephi, having been born of goodly parents, therefore I was taught somewhat in all the learning of my father. And having seen many afflictions in the course of my days, nevertheless, having been highly favored of the Lord in all my days, yea, having had a great knowledge of the goodness and the mysteries of God, therefore I make a record of my proceedings. So he was born of goodly parents. He had good parents. They taught him the right ways. But he says, nevertheless, having seen many afflictions in all of my days. And nevertheless, having been highly favored of the Lord in all of my days. So that's pretty common to have lots of afflictions, but on the contrary, to be highly favored of God. I've seen this in my own life. I won't go into details, but I do know that afflictions sometimes can help us grow and help us to become better. And especially when we turn our hearts and our minds towards God, those afflictions actually kind of lose their power. And we can know who is in charge. And a lot of times I see these cases and I see patients who are in situations like this, and they feel very afflicted. They feel very like, why me? Why do I have to go through something like this? And it also shows a sense of neglect and just like I've given up. And another part of our channel is we want to help people to know how to get out of these situations and to not give up and to know that God is very well aware of you and your situation. That doesn't mean the afflictions are going to be taken away. I could literally spend another 3 hours talking about some of the afflictions, and I'll call them experiences, that I've had over the years of my life. But they've been experiences, and through those afflictions, I've seen my Father in heaven support me and give me the strength that I need to manage through those afflictions. And so, as a result, I would like to encourage each of you to think of the term nevertheless. Nevertheless. So, yes, that car cut me off on the freeway. Yes, maybe money's tight. Yes, maybe I'm being disrespected by coworkers or family members or whoever it may be. But nevertheless, you are highly favored of the Lord. God knows you. He loves you. He wants what's best for you. But he's not going to take away these trials. They are definitely going to be there. But nevertheless, we know that he is there for us. And that's more powerful than the trial itself. Anyways, I'm Dr. John Willardsen. Wanted to share this with you today. Thank you all for watching. Hopefully there was some good information there. And I'm grateful for Memo Hea, my compadre over here, and also Dennis, who does all our audio and video. And we look forward to seeing you guys all next week, and hopefully we'll have some more good stuff for you. Again, hit that like and subscribe button, and tell your friends. Tell your friends about what we're doing here, and it's a pleasure to be able to do this. I'm Dr. Willardsen, and